Welcome to our session, Citizen-Centered, Inclusive and Trustworthy Health Data Governance for Better Preparedness to Future Pandemics, Perspectives from Switzerland. We are really happy to discuss this important topic in our session today with our distinguished speaker, Ambassador Mandeep Gill. But before we dive deeper into the session, let me first introduce myself. My name is Moritz Fegert. I'm a project manager for international digital health at Foraus, the Swiss think tank on foreign policy. And together with my colleague Isabel Knobel from our partner organization Sensor Advice, we have been working on the project Health Data Governance, What's in it for Switzerland since the beginning of the year. Before we talk more about this project a bit, let me first walk you through our session. Our session is structured in two parts. First, we will briefly talk about our project and discuss the outcomes from the discussions that we have had since January 2020 with people all over Switzerland regarding the use, the exchange, and the processing of health data, discussing what fears they have for the future use of digital technologies and health data, but also what kind of opportunities they see for the future. And then in the second part of the session, we will then have the honor to welcome Ambassador Mandeep Gill and discuss in more detail what trends he sees for digital health and health data in the future, and also how his organization, the International Digital Health and AI Research Collaborative, which is also called IDARE, what trends and what opportunities he sees for IDARE in the future, and how this organization can contribute to leverage health data and digital technologies for public health and also to fight pandemics more effectively in the future. So now let me give the word back to Isabel.
Thank you, Moritz. So welcome also from my side. First of all, it's a great honor to be able to speak at the UN World Data Forum this year. And we would like to congratulate the organizers for making this forum possible despite the circumstances of the ongoing crisis. So, however, the pandemic has clearly highlighted the importance of data and digital technologies. Over the last few months, we have seen that the use and exchange of health-related data have an immense potential to fight the spread of COVID-19 more effectively. Data are crucial, for example, for tracking and tracing of infected individuals and communities, for the search for vaccine or treatment, and also for outbreak prediction, just to mention a few. Yet, what we have also seen, the use and exchange of health data raises many legitimate concerns. There are challenges remaining that need to be addressed, which are not only of a technological, but also of a legal, political, and ethical nature. Should health data be considered a global public good and be equitably accessible? And if so, how do we achieve this? How can we ensure data safety, security, and privacy? These are questions that need to be addressed, I think.
Yeah, I totally agree, Isa. I think there are many challenges that remain for the future, and the current crisis has really highlighted some of these. We see that the absence of commonly agreed data collaboration standards and principles in public health, they really bear the risk to exacerbate existing divides globally but also at national levels. And it has been already highlighted in the Global Action Plan for Sustainable Development Data that global alignment on production and dissemination of data and capacity building mechanisms are urgently needed. And this not only amongst national statistical systems, but also, and most importantly, in partnership with stakeholders from academia, the private sector, and civil society. So we really believe that it will be really interesting to do a session at this year's UN World Data Forum to talk about health data governance and how it could serve as a vehicle of trust to better address future pandemics. But now let me briefly introduce our project, Health Data Governance, What's in it for Switzerland. Basically, since the beginning of 2020, we have been discussing about this question of health data governance and how we could leverage digital technologies and health data with decision makers, but also the broader public in Switzerland through an inclusive and participatory process. On the one hand, we organized roundtable dialogues with experts from politics, administration, academia, the industry, patient representatives, NGOs, and also international organizations, and asked them about the challenges and opportunities they see for global health data governance. Then we also held a series of workshops and using our policy innovation platform, Policy Kitchen, with the broader population, but more importantly also with youth, because they are really concerned by the use of digital technologies and data. And with them, we created visions about the use and exchange of personally generated health data in 2030. And this Policy Kitchen methodology really helped us that through also the online platform Policy Kitchen to crowdsource ideas for needed policies and measures on health data governance and digital health. These policies and these sort of ideas that were generated by participants in the Policy Kitchen workshops will now feed into a publication which will come out at the end of the year with concrete policy recommendations to decision makers about health data governance. So if you're interested in our process, in our project, stay tuned and don't hesitate to directly reach out to me or Isabel if you have more questions or if you would like to get involved. You're warmly welcome to do so. So now back to Isabel.
Absolutely, thank you, Moritz. Before we jump into the second part of the session, our interview with Mandeep Gill, maybe I can mention just a few learnings that we took from the dialogues and workshops that we had all over Switzerland. So what has become pretty clear, and what is also the title of this session, is that effective health data governance has to be citizen-centered, it has to be inclusive, and it has to be trustworthy. So one thing that we found out or heard a lot is that to build trust, data ownership needs to be clearly regulated. And for that, governments are important actors. They have the capacity to regulate. But what is also important when we talk about governments, one important role is that they also help to educate people when it comes to data literacy. We all need, like the general public, but also decision makers, we all need a better understanding of what happens with our data. And only in this way we can make sure that we take informed decisions and also reach kind of a social consensus. Our dialogues and workshops have also shown that not only the state should take an active role, but citizens should really be allowed to actively improve public health and their own health with their personal health data. So one idea our participants brought up is that the idea of sharing platforms, which could be established by governments, but also by other initiatives, where you could, for example, donate your data for, let's say, research projects. So overall, it has become pretty clear that to make a step forward in this topic of health data governance, we need more multi-stakeholder cooperation. And we need kind of platforms for, let's say, breaking down data silos and ensuring that not only states, but also like actors from different parts of the society and the private sector, that they come together and contribute to the effective development and use of digital health solutions. And one such platform is IDER, that Moritz has already mentioned. And Ambassador Mandeep Gill will now introduce us to the platform, what it is about. And yeah, we're looking forward to jump into the second part. See you in 2 seconds.
Okay. So now we have the pleasure to jump into the second part of our session. We are really pleased to welcome Ambassador Mandeep Gill to our session. He leads the International Digital Health and AI Research Collaborative Project, which is also called IDER, at the Global Health Center of the Graduate Institute in Geneva. And he's also currently a member of the Global Future Council on Global Public Goods, and also active as a commissioner of the Lancet and Financial Times Commission on Governing Health Futures 2030, growing up in a digital world.
Before assuming his current functions, Ambassador Mandeep Gill was the executive director and co-lead of the Secretariat of the UN Secretary General's high-level panel on digital cooperation. And last year in June, the panel published their report, The Age of Digital Interdependence, with a series of recommendations to improve digital cooperation. So these recommendations also laid the foundations for the UN Secretary General's roadmap for digital cooperation, which was presented in June this year. And so we are very delighted that you can be with us today, Mr. Ambassador. And we are excited to hear more from you about the International Digital Health and AI Research Collaborative, and afterwards also discuss with you about citizen-centered, inclusive and trustworthy health data governance and how this could improve preparedness to the current, but also to future pandemics. The floor is yours.
Thank you very much, Isabel and Moritz, for the introduction, for the warm words. It's a pleasure to be on this program with you. So a brief introduction to the IDEA project. This is a project that's in follow-up to the UN Secretary General's high-level panel on digital cooperation. The report of that panel made a set of recommendations, and I'll start by presenting just a very brief overview of those presentations, essentially to underline the need for digital public goods, for combining these common rails for innovation to scale, and these guardrails for this innovation, this utilization of digital technologies to be governed properly to ensure data protection, privacy, security. And there was a call in the SG panel report for new models of collaboration. So this is where IDEA's starting point is. You know the challenges in the area of digital health. Particularly with data, there is the problem of the 3 M's, as we prefer to call them. There is the misuse of data. The data sets are there, but they are not being put to good use. There is missing data, low information, no information. And then there is the misuse of data. And in IDEA, we plan to address all these 3 aspects together and contextualize the use of data. So we have a lot of in silico prospective tech solutions which don't correspond to the political, social, clinical context in different settings. IDEA is conceived as a platform with a distributed nature. So while we are based in neutral Switzerland, while Geneva plays a strong role, and while we have a partnership with the WHO, we would like the international part of IDEA to come alive through its hubs and spokes architecture. Hubs in Kenya, in India, in Singapore, other geographies, where local data sets come together alongside local expertise, local use context to develop the next generation of digital technologies and artificial intelligence algorithms. This, in our view, also helps us to maximize the engagement of youth from emerging geographies of innovation and preserve this cross-domain overview of health, which is so necessary for successful implementation as we see with the current COVID-19 crisis. One way to visualize IDEA is to think of it as a distributed CERN for AI, a kind of international brain trust where impactful, trusted R&D work is carried out. And where there are opportunities for partners, whether they are academic partners, private sector partners, to showcase a global purpose and to showcase fair and inclusive use of data and AI. This is just a slide to illustrate how CERN has grown over the years, and it has grown through a set of experiments. So each time an experiment is carried out, international collaboration is carried out, you learn something and then you go on to the next level. So in IDEA, we are taking a kind of iterative approach to building collaboration, building habits of cooperation across academia and other partners across the globe. This is how we look at our value add, in a sense, looking at some of the neglected enablers technologies, looking at the middleware, the digital health tools, looking at the governance solutions, looking at some of the open source technological solutions that can be put together in different contexts as per the local requirements. We have a diverse team of cross-domain professionals that has been working with me since the summer to take IDEA to its next phase. And this next phase will be a 2-year phase where we prepare for a launch in 2022. And the launch idea is essentially threefold. I mentioned this hubs and spokes architecture. I also mentioned the launch of the CERN-like global problem-solving efforts, but we also want to stimulate investments into digital health and AI research. And this will be done through an impact fund, which has a threefold focus. So the research issues, investments in interoperable data architectures that support that kind of research and development, and then investments in capacity. So capacity for research, capacity for development of digital health solutions. If you go back to the theme of the data forum, then in a sense, the long-term vision is to shift the focus from hoarding data to the flow and use of data. So go from the silos-based thinking, the disease domain-based thinking today, to more interoperability. And while doing so, still respect fully the national and regional requirements on data protection and use. And this, we think, can be done with our hubs and spokes architecture and the way we've conceptualized our work. So just briefly to mention the progress that we made since we started the pre-incubation phase. We put together a series of partnerships. The Botnar Foundation, based in Basel, has made a significant investment commitment into this project. And then we have commitments and investment interests from other global foundations. And a set of partners have started to come together: the London School of Hygiene and Tropical Medicine, IEEE, FINE, PATH, and so on. Alongside, a number of hubs have started to come together in Singapore, New Delhi, Nairobi, in Geneva. So this has been good progress. And I want to speak a little bit on the substance and maybe conclude with a reference to our work in the COVID-19 context on real-time epidemiology and dashboards. So to frame our substantive work, we've defined a set of pathfinder areas. And I will quickly show you what these pathfinder areas are. So they span the range from situational awareness through a global research map to governance for AI and data for health. So between these two bookends, we have a range of other areas which we believe are important to explore in order to shape the data, digital AI ecosystems for health of the future. So most importantly, in the current context, real-time epidemiology and dashboards, mental health issues, new metrics of well-being and mental health with a focus on adolescents, data interoperability and data architectures, digital innovation in health systems, new kinds of benchmarking solutions, mixed benchmarking where qualitative perspectives, human-centered perspectives come together with quantitative perspectives to drive the next generation of digital health development, and so on. So this is our structure for pursuing substantive work. And just to illustrate how this works in practice and what does it do for us. So with these, from within these pathfinders, we've selected 6 key areas for focus during the first 2 years. And we will work on them with the hubs. So what happens across the hubs is there is a common problem definition, there's a common research design, and the data architectures remain local but they contribute to addressing this commonly defined problem. So their power gets aggregated without aggregating the data. And then the learnings coming out of these Pathfinder areas help us to develop these three outputs over the next 2 years: a technology development roadmap, a scientific agenda for future research, and a capacity building roadmap. I want to stop sharing this general slide deck and show you a slide from our work on real-time epidemiology and dashboards before concluding. This is work that we have done with partners in India and in Southeast Asia, essentially to address this problem of lack of modeling diversity. So the predictive models that are out there are just come from a few geographies, and the data sets they use are not diverse enough. What happens is most often they use mobility data or epidemic data from hospitals, public health agencies, but molecular science data doesn't get integrated. And some of these, what we call micro narratives, the qualitative data in terms of the impact of some of these solutions being rolled out, the measures being taken, also doesn't get integrated in real time into the mapping of the spread and the response. And interestingly, their policy impact is not impactful enough. And we looked into it. And one of the lacuna is that the dashboards are not intuitive, evocative enough for policymakers. They don't really reflect what a policymaker is thinking about. I mean, this should be obvious that when you design something, you first ask those who are the customers, what is it that you like to see? But often the instinct has been, let's put something out and then take it to the policymakers. So we tried to look at this problem from the angle of these lacuna. And we got interesting results. One of our partners developed an SEIR model for a city in India, and it helped the authorities plan the pandemic response, look at how beds should be allocated, how many beds would they need in a certain period of time, and also tighten the loop in a sense between the modeling work, what's happening on the ground, and the policy making. Another one of our partners looked at integrating these different kinds of data sets, in particular micro narratives, qualitative assessments based on interviews with doctors and other health workers. And we figured out that at least in one aspect, these acted as a proxy variable for missing data sets in the modeling work. So this has been very encouraging, and in the next phase, we want to develop more sophisticated AI models through this kind of a collaborative research. So let me stop there and turn it back to you.
Well, thank you very much for this very insightful presentation and this overview over IDARE and the Pathfinders and what you are doing. This is very impressive and I think very important, as we can see now. My first question would be around this field of real-time epidemiology that you just mentioned last. How would you assess the use of digital technologies and the use of health data in the current pandemic, and how you already mentioned a few examples of how we can address this better in the future, but what could IDARE also contribute to that? Yeah.
Yes, that's an important question. I think we've seen several attempts at using digital technologies to fight the pandemic. One area of work has been with risk assessments. So looking at what is, there's been the spread of misinformation. So people need to get the right information. They also need to assess their own risk and the risk they pose to others. So it's been a critical area for the deployment of digital technologies. Another area that has worked well in some geographies, but not so well in other geographies. So this is something that has kind of left us dissatisfied. There have been digital tools for mining research. Large number of papers have been published on vaccine candidates, on therapeutics, and so on. So machine readable, AI-based digital tools for mining research, they've been quite useful. And then there is this new phenomena of digital collaboration platforms for sharing genome sequencing data, which kind of map, how the virus is mutating, etc., almost in real time. Then I think two areas which have not been explored enough. One is this pandemic modeling and dashboards going beyond the IDM Seattle or Imperial College London, Johns Hopkins type of models. And the other is remote triage and testing. So the use of cuff audio-based tools for triage, in a sense, managing the cascade of patients coming through the healthcare system. That's something that has not been explored as much as it could have been. Overall, if you ask me my personal assessment, this is not IDEA speaking, I think we could have done much better. And in a sense, we kind of showed the weakness of digital use and data use to the world. A lot of the countries eventually relied on analog tools, the German tracing and tracking efforts, the American as well. So obviously, I think this is a wake-up call for all those who are interested in responsible, efficient, and sustainable use of data and AI in health or other areas, that we need to kind of rein in our impatience and need to think about some of these longer-term issues, the interfaces with the analog world, and then come out with more impactful, wise solutions. I think otherwise the politicians will say, look, you're just creating a lot of hype and you're not doing it right.
It's really interesting that you talk about exactly missed opportunities, or maybe what this crisis has been showing. I have a question regarding the role you see for citizens, also because with our project we have been talking to citizens and trying to set up to talk about this issue in a more inclusive way. And how do you see maybe also in terms of citizens, the role of citizens in the use of digital technologies, and also in the current crisis when you talk about tracing apps maybe not being used as effectively as they could? Where's the role for citizens in the future use of digital health technologies in your views?
I think that's a great question. So this question of citizen science, citizen involvement, I think if we are to turn data for health into a public good, it cannot be done without citizen engagement and citizen involvement. So I think there's been a rise in awareness about privacy, about data protection. At the same time, we need to have a citizen level rise in awareness about the potential of individual data contributing to public good in a respectful, safe manner. So I think this is where a lot of work lies ahead, but a lot of potential too. The other is agency, the issue of agency, that when your data is used for any in a device, so how much agency do you have over that use? And it's not so much control, but it is more like the human aspect, the human interest, the human interface remains important than the technology itself. So I think there again, some work is required in terms of citizen engagement, citizen involvement. But I'm very, very excited about this area. There have been some good experiments in Switzerland with nutrition, there are groups in Basel, Lausanne, Zurich that have created very nice use cases around citizen engagement. And I think we've just started to scratch the surface.
That's a very interesting remark, and I would like to follow up maybe a little bit on that. Can you still hear me? Yeah. Okay. So in our dialogues that we also held across Switzerland with decision makers and also the youth, there were a lot of people saying that the literacy, the data literacy, is not sufficient, even among decision makers, but also not more in the general public. So, do you see that as an issue as well, and how could we maybe contribute that this becomes like better, or to improve this kind of health data literacy also, that we explain better what we are talking about and what needs to happen?
Yes, definitely. And this was a problem with digital use during the COVID-19 response. The literacy wasn't there. The explanation, the communication across data science and public health was deficient. I think it requires a multi-pronged, multi-year effort. Some of it has to start in schools. So there are these, artificial blocks created in the minds of boys and girls, particularly girls. So there is a gender discrimination issue here, that data is somehow about numbers alone, that it's about maths. Whereas we need to kind of take the data science discussion out of the maths and computer science classes and into more interdisciplinary settings, and have children begin to think about data, how we categorize people, how we make assumptions and predictions based on limited data. So this kind of a self-awareness of the importance of that side today. And then part of it is, of course, understanding what the new tools are. Like anyone who's done statistics and data science 10 years, 15 years ago, when you come to platforms like R or the use of Python and machine learning for data analytics, you're surprised. I was surprised. I did my engineering in the 1980s and we did coding back then. And then more recently, I kind of revised my basics. And I was surprised by the power of the new tools. So I think even with the experts, there's a lot of scope in making them understand the power of the new tools. And then the limitations. So sometimes, we go too much to the optimistic side. We think, data can solve any problem. But when you actually have to do an assignment in data science, you realize how difficult it is. Some of the data is messy, it's dirty, it has to be cleaned up. A lot of things are missing. And then, all the assumptions are not clear. So this is a massive, massive effort. I think what's missing here is the public sector, governmental kind of high-level push to this in terms of investments into capacity building and data literacy. The private sector is doing very well. I think what we need is something on the public sector side, on the public education side.
Maybe one question also regarding involvement of the public sector side and general governments is around the main topic of today's session as well, and you have been mentioning it before, is health data governance. You also say that health data governance is one of your Pathfinder's goals, or at least it's contained in one of your Pathfinders. My question would be, what is your vision of health data governance? What kind of governance do we need, and how do you envision it for the future, and the role of IDA in it?
Yes, again, a great question. Our vision in IDA, and let me just not say my personal vision alone, because we've discussed this, thought through this, is that data governance has to be distributed. It has to be tiered. So everything cannot be done at one level. So an international treaty cannot solve every problem. So a lot of national level regulation, then a lot of industry level, enterprise level standards and regulations. It also has to be distributed in the sense that we shouldn't try and kind of pull things together into one basket and then regulate it. This also allows for at the edge and then come to the center. So this dynamic between the periphery and the center can take hold. And it has to be agile. Agile in the sense that the traditional normative cycle in terms of you decide a norm, you take it to implementation can sometimes go to 10 years. That's too long. So we need kind of tighter loops between the practice of governance and the decisions on governance, which we hope to do through our pathfinders. And we also need a kind of agility in the kind of tools we deploy. So not just hard governance, but also soft governance, peer pressure, certification schemes, audits, trusted labels, etc. So there is a range of soft governance tools that can be deployed. The other day, someone asked me a question in a panel, but how do you ensure coherence in a distributed governance of data, in a tiered approach to data? I think that's one of the fundamental weak points of such an approach. So you have to think about it ahead. And one way to ensure that coherence is for a governance dialogue between these different levels through, parties such as IDER or other forums such as, in the UN, where these different tiers of governance can say, okay, this is what we're doing, and so they can share their experience with each other. Another way to ensure coherence is to have common principles. So the values, principles, and maybe some of the mechanisms used for governance can be agreed together and can be shared across these tiers so that they're more coherent in terms of their operation.
So maybe if I can follow up on this governance question, you mentioned before that IDER also wants to stimulate investments, create an impact fund. So I think also health governance, health data governance needs some kind of financing probably, or collaboration, let's say, of different actors. And how would you, or where do we need to start? How do we bring about meaningful collaboration?
Yeah, that's a tough one. I think the exercise began with the UNSG's high-level panel in some ways of collaborating around governance, around digital governance. So these three models of governance that were proposed in the report, and then there is now a roadmap, and that's being taken forward. Then there is a kind of health-specific exercise which the Lancet Commission, co-chaired by Ilona Kikbush and Anurag Agrawal, is looking at. The WHO has started its own discussions, the digital health strategy, some of the guidance that came out during the COVID-19 pandemic. So I think the initial groundwork has been done. What we now need to do in terms of investments in particular is invest in governance capacity. So this cross-domain understanding among public officials, policymakers. We need to invest in some of these soft governance tools, and also sandboxes where some of the products where the risk might be high can be tried out, and then the governance can be adjusted in an agile manner depending on the result. So a lot of these little investment areas are becoming obvious. Yes, there is always scope for investing political capital or simple capital into these international agreements. So there has been a proposal from the civil society foundation side for new regulation on health data on par with what you have with the tobacco control work and with the pandemic information sharing commitments agreed upon in the WHO context. But I think you need a kind of broader palette, so you need to invest in those other aspects too. And I think there is a scope for improving the technology related aspects too. When it comes down to the data somewhere, you end up with only those options, those few options, etc. Or you have to create your own infrastructure. So is there a way in which trusted, neutral infrastructures can be created which help you store data, use data? Is there a way in which escrow solutions can be found? Like in IDEA, we are very much interested in those, whereby data and algorithms can come together in trusted settings and be used for specific purposes. So those efforts, those collaborative efforts, would also need investment. And to my mind, that's probably the most transformative use of these investments.
Talking about collaborative efforts and also WHO, I'd like to come back to Switzerland and where we actually are situated, to ask you, what role do you see for the international Geneva in these efforts, and where is the added value of Geneva as the global health capital, and Switzerland as which has always been a place for multilateral dialogue and international cooperation?
Yes, I think there is a role for international Geneva. And if you look back in history, Geneva has been a pioneer on several ideas of international collaboration, whether it's the humanitarian side or it is international education. So in this domain too, there is a lot of scope. The relevant organizations are here: WHO, ITU, others, Gavi, Global Fund, several academic institutions like the one that we are based in, the Graduate Institute, and others who have been researching these areas for a while. CERN is there, where the World Wide Web was invented, and CERN, which operates one of the most efficient data infrastructures, efficient, low-cost data infrastructures anywhere in the world. So all these are tools, in a sense, strengths are there for international Geneva. I think where the focus today should be is in terms of innovating with forum design, with forum governance, because we no longer have the luxury of high-cost dialogues and high-cost collaborations. So in a sense, we need to be more agile with how these dialogues and these collaborative forums work. But we also need to lower the entry barriers to more players, potentially more innovators and leaders from around the world, and be more inclusive, therefore, in the approach to building international collaboration out of Geneva. So Geneva as an international city needs to kind of fall back on its DNA and link together with other international spaces from that fundamental level, and not so much the more recent level of the UN system or particular large international organizations, etc. I think we become too comfortable with that type of a setting, and we need to push ourselves a little bit into a more of an uncomfortable zone and innovate a little bit.
And I think COVID-19 has all taught us to be innovative in how we proceed with things we have been accustomed to do. I have a last question to you. I would like you to think about the future and imagine your ideal vision scenario for 2030. How would it look like?
Yeah, I would very much like to see in 2030 the view of data shift completely from the current, beggar thy neighbor, data is the new oil and let's grab whatever we can, to a more collaborative view of data. So that's the one thing I'd really like to see. And then a related aspect is that I like to see a lot more people engaged on data for development in a distributed manner. So if you have Kenya or in India, I like to see that grow to 2,000, 5,000. It should become a mass movement in terms of data use, collaborations around data. And three, obviously from the idea perspective, I like to see a first-rate, innovative, multi-stakeholder collaboration come together, centered in Geneva, but hubs and spokes architecture that brings scientists, innovators from around the world together to solve the world's health problems by leveraging data, by leveraging AI, or whatever we might be calling it in 2030. Because AI is in many ways a very limited concept and doesn't quite convey what it should be conveying.
Yeah, thank you very much. I think these were actually several visions that you have for 2030, and we're really looking forward to the future and to see where we'll be in 2030. But we're confident that this current crisis, although it's a terrible crisis for humanity, it also brings some learnings. It shows the potential of digital health technologies and health data, but also the existing weaknesses. And you have really well pinpointed these weaknesses and what needs to be done. So just to wrap up, you called for distributed or forum-style governance, to have common principles on the use and on the processing and exchange of health data. And what you said also was really interesting is that governments need to invest in data literacy because this has been missing. And finally, citizen science and engagement is needed so that we can really leverage existing and future technologies and leverage the potential for healthcare and health in general. Yeah, so thank you very much for all this great input from you, and give the word to Isa for the conclusion.
Yeah, so thank you very much, Mr. Ambassador, also from my side. I think it was a very insightful presentation and also discussion afterwards, and I wish you the best of luck with IDARE. I think it's a very important initiative, and we will follow your progress closely.
Thank you so much, Isabel. Thank you, Moritz. All the very best to you. It has been a pleasure speaking with you. Thank you.
It's been a pleasure. Thank you very much, Mandeep.
Goodbye.
Goodbye.